Right, over to Emma.
Right, thank you very much. So I'll firstly apologise to say I've got no pictures of water, beaches, kittens, puppies, whatever you want. I'm the boring NHS manager. That's why I'm last on the agenda today. So I'm Emma Latimer. I'm the place director and I work for the Integrated Care Board in South Yorkshire. I assume you all know what an ICB is because we change our name every 2 or 3 years into something different. But effectively, we get the money from NHS England to spend on local services. And what I would say is, just starting with you, Ollie, is belief. So you've got to believe, haven't you? Because I work in quite an interesting environment where every day I'm asked about how many people have been discharged from our local hospital, the same as yesterday, the same as the day before, what my ED performance is like every single day, rather than, how many people have had a great experience of care, how many people feel that they are valued as part of our workforce. So I think that we have to believe, and I have to believe as a leader, that there can be something different in terms of what we can offer our patients. So going back to your points around, I don't think I've ever, I've been in the NHS for 34 years, I don't think it's ever felt quite as bad in some ways in terms of COVID recovery, in terms of elective recovery, in terms of putting everything into hospital-based care. It feels really difficult. But today, I'm really here to talk to you about, I suppose, the why, and I think we've already rehearsed some of that in terms of the long-term conditions that we face, what the next 20, 30 years is going to look like in terms of the demand on healthcare and access to healthcare. I'm going to draw on a couple of examples. So I was previously a chief officer in Hull Clinical Commissioning Group, where we did some great work around frailty, and I'll also just touch on some work we're doing here in Sheffield around building a model neighbourhood, and I'll talk to you a bit about that. And I guess the last thing is, how do we make this stick? I looked at the number of people receiving personalised care in Sheffield. It's woeful, absolutely woeful. Nobody holds me accountable for that. Nobody. They hold me accountable for overspending, they hold me accountable for elective performance, but nobody talks to me about any of that. So if we are going to be different as an NHS and a care system, then how do we start to shift that mindset collectively together to make sure we do something different, because this NHS will not survive if we carry on in the way that we do. So that was just, a bit of an uplifting start to our presentation. It does get better. So again, you probably won't be able to see this, we'll share it on the slides, but again, there's a great report that's been done by the Health Foundation that starts to look at demographics over the next 20 years up to 2040. And what you can see is that these conditions, so chronic pain, COPD, diabetes, cardiovascular disease and anxiety and depression, they are going to have the biggest impact in terms of spend and access to healthcare. So if we can do something now to make a difference in terms of prevention, I think we've got a really good chance of making sure we can start to put more money into investment areas, secondary prevention, primary prevention, into coaching, etc., to try and ward some of these things off. And I've had some great discussions with Ollie, particularly around chronic pain and potentially what we could do around that. But we need to make it mainstream. We're great at developing pilots in the NHS, but we don't absolutely upscale them when they work. We put additionality into a system but don't stop anything, and we wonder why we never get anywhere. So we really need to think about where we spend our resources over the next 10, 15 years. And again, as I talked before, just, when I looked at even the targets that are set out in the long-term plan around personalised care, they're pretty woeful in my head. I don't know where they came. Sorry, I'm not looking at you. I don't know where they came from, but it doesn't feel very ambitious, does it? So, how can we be more ambitious in our quest, really? So, just a couple of examples I want to draw on. So, first of all, is the work I'm doing in the northeast of Sheffield. So, when I came in, of course, everybody's business is health inequalities, isn't it? We all say we're doing it, but we probably weren't. So, what we're doing in the northeast of Sheffield, which is our most deprived area, we've got 4 wards, 4 neighbourhoods, and we're calling it building a model neighbourhood. And what that essentially means is we are trying to shift power to communities. So, me going in or sending any of my managers into an area and telling them what we think they should do is not the way we should be working with our communities. So this was very much around saying, as an NHS organisation, how do I start to invest money? And I'm talking about recurrent money now, not, 50,000 here and 100,000. Actually, we're starting at, we've got probably just about 2 million. Now, that's not a lot, but it's, it's sizable in terms of recurrent investment. when I'm in an integrated care board that is overspending. So I'm constantly being told, you know, we need to, you know, what's that, what you're doing, where's the evidence for that? Well, actually, if we don't invest in other things, we're never going to make any difference. So we are looking to build a community capacity of individuals and neighbourhoods to help them address the things that matter to them. And that doesn't mean it matters to us, and often those things aren't health related, they affect the wider determinants of health, where you live, your education, your housing. So actually, but really empowering our communities and devolving power to them in a very different way. So the key ingredients that we're taking is devolving power, we're prioritising those relationships and being radically inclusive. So we know in some of those areas there has been a lack of investment for years, particularly in some of our BAME communities, and we need to address that. We're asking the communities themselves to produce those plans, but we're also investing in them as people and leaders. So this isn't just about saying, you know, we've got voids in particular services and we need to fill those voids. It's saying, how do we invest in that leadership and the capability of those individuals? Because often you find when you go into communities, these things actually relate to one individual who's really passionate about something. But again, if we want to make it stick, we need to take communities with us and invest in their leadership capacity and capability. So this programme is just much more than just saying, we'll give you a bit of money for grants. It's actually thinking about how do we make communities resilient, how do we support them in their quest. So we've got a great partnership at the moment, and it involves the voluntary sector, NHS, the City Council, the police, primary care networks, and New Local. I don't know whether any of you have heard of New Local, and I can't put anything up that's any colour in my job, but they are a great independent think tank who are looking at policy reform at the NHS, and so they're actually going to be evaluating this work, which I think is brilliant, because what I'm saying is this needs to change policy. I don't want to just do another little pilot in Sheffield. I want to say, how can this pilot start to change policy? We talk about left shift. We're nowhere near left shift. And so how can we start to think about prevention and putting resources elsewhere? So we're doing sense making, we're investing in the voluntary and community sector, we are working with our communities, we are asking them to produce their own plans and signing them off. I'm not asking anyone to fill a 100-page document in to tell me what they're doing. You know, we've got to believe some of this is in your own gut. You know, people who've worked in the NHS for years know what it's like out there. And actually, I don't want 20, 30, 50-page reports every month. You've just got to have a bit of belief, haven't you, that actually something's got to be different, something's got to change. But by bringing in New Local, they can help us draw that evaluation and hopefully put that in front of whoever's eyes it needs to go in to try and support what we need to do here. So, really proud of that. And this, so I've got one picture, but obviously it's not very exciting. The Jean Bishop Integrated Care Centre. So when I was in Hull, lucky enough to be able to develop this. So the Jean Bishop Centre was named after Jean Bishop, the bee lady, who worked for Age UK for years and raised loads of money. So every time I went into ED, you know, you saw people sat in beds, in chairs, old people who we were failing every single day. You know, demand failure, multiple medications, often going in, never coming out, never even going back into their own home. People who'd lived on their own for 85 years, who could manage every day of their life, all of a sudden couldn't any longer because we damaged them, because we put them into a hospital ward, in a hospital bed, and we've done lots of things to them that probably made no difference to their life, probably made it worse actually. And I was ashamed, absolutely ashamed of this. So I had some great people around me. I had some great clinicians, some great community geriatricians, and together we decided we were going to develop a integrated care centre, which we did, which is there. And it basically, we looked at all the frail elderly population of Hull. We used the Electronic Frailty Index, identified our 12,000 most frail patients, and we built a building that again had everything in it. So we had a community cafe in there, we had physio, OT, social work, mental health, we had CT scan, we had x-ray, everything under one roof. We also had support for carers. And what we did is we invited those frail elderly people in for a half-day assessment. They had a full assessment. I went round with some of them, it was great. I think I saw 47 medications for one lady, you know, and they got everything in one room. And people were coming up to me with all these appointment letters and saying, Emma, I don't know what these are. I've got, you know, 5 operations, but I don't know what they are. I don't want any of them. And so again, we just keep doing things to people that they don't want. you know, they had no choice, they had no say in this. So through this centre, what we did is we gave every single frail patient an assessment, and we basically then developed a plan. And you know, one fantastic story from there was a guy called Ray. I haven't got it, but there is a video. If you search on YouTube, you'll see the ICC, you'll see Ray's story. And Ray had lived in one room for about 12 years of his life when I met him, and he hated Wednesdays. And the reason he hated Wednesdays is because his wife, his main carer, used to go to Morrison's, and he was incontinent. And he was absolutely petrified every week that when she went out, he would wet himself. He couldn't get out of the house, he had no way of access, he had no wheelchair, he had no ramp, nothing. So within about 4 weeks of meeting Ray and Ray having an assessment, he had an electronic wheelchair, he had a ramp, he had grab rails, and he was able to go to Marks and Spencer's for a coffee, which he hadn't done for 12 years. And you know, for him, that was life-changing. And the thing for me is, why haven't we done this 10 years later? Sorry, 10 years before. You know, why are we doing this to people? You know, this is common sense. It's not difficult. It took some bravery and a bit of courage around how we paid for it and how we got it in place. But this is what we should be doing. And this is what we should be doing in the NHS, and we shouldn't be ashamed of that. And people say, oh, well, we haven't got any money. We have got loads of money. We just don't spend it in the right places. So we just need to challenge ourselves constantly about what we do. So this is just to give you a bit more of the detail. I think the other thing is we had team objectives based around the patient. And what I've found more lately in my career is if you set objectives for teams rather than individuals, I don't know, there seems to be a bit more sense of belonging, people feel a bit more energised, and actually teams work better with teams. So I think, you know, one of the maybe thinking piece from today is actually when you start thinking about what you want to achieve, actually how do we set more team objectives and get things done? So in this case, we reduced emergency admissions for that cohort of patients by 50%, for over 85s by 19%. You know, that is really, really credible thing. You know, and it's not me, this was the fantastic team that led this. But, you know, it was great to see that improvement and the difference it made to those patients' lives. And that's what we're all here for, isn't it? It's estimated to save the NHS 53 million in terms of medication, pharmacy, admissions, failure demand. And it's a national exemplar for anticipatory care. And just to say, there are no beds in this facility. It's not a bedded facility. It is about wrapping services around people and their carers, because that's another thing. We forget about carers. They're so important in this. So, in terms of making it stick, the final slide, I'm pleased to know, I think we need to build a baseline for prevention, and we need to start moving from a moral case to a business case. And this is something that Bola, who's our National Director of Health and Equality, talks about a lot. You know, we need to think differently. We need to make it stick. We need to strengthen accountability around this. So as I said, you know, no one's ever asked me anything about personalised care. No one holds me accountable. So how are we going to hold ourselves jointly accountable for this agenda? How are we going to put things in place that start to make the difference and shift the dial? Long-term commitment to dedicated funding and evaluation, we need that as well. You know, we have got a new government coming in. Hopefully we might have some discussions with them about how this might work. Obviously we've got public health budget in one part, we've got the local authority who've got lots of resource as well in this space. How do we collectively work together to make sure that every pound we spend makes a difference? And again, building those team objectives, I think that's one of the things I've really thought has been a success. You know, when you get a team around a vision, an opportunity, you know, it really does work. And I'm so grateful for the people I've worked with, you know, alongside me that have done some of this brilliant work that I'll always be proud of. So that was really all I wanted to say. As I say, sorry, no pictures, nothing exciting, but really just sort of, you know, it is possible. And people like me can create the conditions to help deliver that, but you need to help me, you know, realise that vision and make the people above us, because there are a few, really want to invest in this agenda. So I hope you have a brilliant day. Thank you very much for listening to me, and any questions I'm sure will be next. So thank you.